Good morning. It's still morning, early morning, kind of. I'm Ashton Nesmith Kochera, and I'm from West Virginia. I'm a patient. I've been a caretaker, and I am a board-certified patient advocate. And today, I was not sure what story to tell. I feel like I am here for so many reasons. And I'm actually writing a book currently because there's just so many stories I could tell. But today I'm going to just give a glimpse a little bit into insurance with my daughter. I was actually a chronic illness patient all of my life, basically. We found out it was genetic once I had my daughter, and she presented with the same symptoms starting around 3. And around the age of 7, she went in for a dental appointment, and they told us she just had a small cyst, and they would go in and they would remove it. She was actually set to have her tonsils and adenoids out anyways. So it was going to just be one simple procedure, we thought. However, when they got in there, they realized the cyst they had thought it was not a cyst, and it was a tumor, and they didn't want to touch it yet. So they took a biopsy, and they sent out for the biopsy. And at that point, she developed symptoms where her GI system shut down for 11 days. And we were in the pediatric unit, and she ended up on TPN. And at that point, I think it was day 10, her oral surgeon called and said, you know, we really need to see you in the office. We have some results in. And I said, you know, we're still in the hospital. I mean, we're not even able to get there. And he said, well, I think we need to see you. And so right then I was like, could you just tell me? And he says, no, we really need to see you. So this long drawn out situation, we ended up in his office that evening without my daughter. And we found out while she's still recovering from one surgery that she's going to need another surgery as soon as possible because this was a rare and aggressive tumor that needed to come out. Well, that's when the insurance process started, and it took us 3 months to get the insurance to approve to have this taken out. And after 3 months, thankfully she recovered from that surgery okay, but when they sent out the tumor, it came back that it had what started as just a tiny, what they thought was a cyst, ended up taking part of her jaw, all her bottom back teeth, and even now, 5 years later, she is still undergoing extensive reconstruction. And so it just takes one fight with the insurance company where we couldn't get it approved, and it affects her speech. And I guess it's mind-blowing to me that it could have just came out easily, just maybe even within a month, and it wouldn't have got to that point. And to this day, we still have to fight to get her, because of the chance of it coming back, she has to have MRIs and imaging done once a year. And every year they still deny it. And for the MRI, we have not had one MRI since she's had this. They will only do x-rays. And that's just really frustrating for me, especially as an advocate, because my advocacy skills go out the window when it's my daughter. So that's basically my story, but thank you. I appreciate the opportunity.